Let anyone tell you there are things we cannot change. We've done hard things before. We'll face hard things again, but we're doing it. We've spent the past 20 years advancing ways to repair heart valves so more people can return to their normal lives. When every second counts during a stroke, we're shaving hours off treatment times to save more people from disability. When some people experienced mysterious COVID symptoms and had nowhere to go, our team created the first center for post-COVID care. And so thousands of people will live, will go back to their kids, their partners, their parents, simply because a whole bunch of people in here keep making medicine better. So if anyone ever tells you there's no other way, don't listen. We find a way. Mount Sinai.
Welcome, I'm physical therapist Jimmy McKay. Today we'll be sharing insights from a recent publication on post-acute COVID-19 syndrome, or PACS. It's clear that in the wake of the COVID-19 pandemic, a second, longer-term public health emergency has emerged. It is imperative to understand the burden of this novel condition, with millions of Americans at risk of developing PACS by the end of the pandemic. Today, we have some of the contributors from a study. They are my colleagues from the Mount Sinai Hospital and the Abilities Research Center. They'll share insight about what this resource found and how it can be used to help people living with PACS. First, we bring in Dr. Jamie Wood. Jamie is the innovator in residence at the Charles Lazarus Children's Ability Center here at Mount Sinai. Jamie, welcome to the broadcast. We appreciate your time.
Hi, Jimmy.
First, let's talk about some of that research. Let's talk about how it was initiated. How was that data collected in this piece?
So at the start of the pandemic in New York in March 2020, our team quickly mobilized to deploy home monitoring for people with acute COVID infection who weren't admitted to hospital. So taking on hundreds and hundreds of people with COVID-19 infection. And after weeks to 1 to 2 months, they started to notice that around 10 to 15% of the people were still reporting symptoms and hadn't recovered. And so there was an initial cohort of people who remained on being monitored by the team. And then with the establishment of the first post-COVID clinic, more and more people from New York State started joining the clinic and being monitored by our team. So in the end, well over 1,000 people were enrolled in the program.
All right, let's talk about those over 1,000 people enrolled. Can you describe the people who participated in this study for us?
Sure. So the number of people that are in this particular study were 156, which we believe is a fair representation of the bigger cohort. Around 2/3 female, relatively young in age, with a median age of 44 years, but a spread from 39 years to nearly 80 years of age. And interestingly, while we know that hospitalization isn't a perfect marker in terms of acute illness, especially when people couldn't get access to hospital beds, only 11% of this cohort were hospitalized at the time of acute infection for COVID-19.
All right, Jamie, thanks so much. We'll bring you back in just a little bit. Up next is Dr. Jenna Tosto, a physical therapist and the clinical director at the Abilities Research Center at Mount Sinai Hospital and the Charles Lazarus Children's Ability Center. Jenna, welcome to the program.
Thanks so much for having me.
All right, Jenna, you get to talk about PT stuff. All right, so let's talk about what were those patients typically reporting?
Sure. So I think what makes PACS quite unique is that the symptom presentation and the symptoms being reported, there's a myriad of them. And so most commonly reported symptoms include fatigue, brain fog, headache, sleep disturbance, dizziness, dyspnea or shortness of breath, memory problems and confusion, mood changes, sweating and thermoregulatory changes, nausea and vomiting, and nausea and loss of appetite. So really noticing that symptom presentation is across systems.
Wow, really, really all over there. So you're talking about symptoms, and as a physical therapist, we want to go from those symptoms to function. So what were the impacts on these people's physical function? Talk about that.
Absolutely. So one of the most significant triggers for symptom exacerbation was exertion. So post-exertional symptom exacerbation and post-exertional malaise were extremely commonly reported. And so when we think about functional limitations, activities of daily living, participation in work, and general daily life was significantly impacted in the cohort.
You bring up a lot of really, really interesting physical and environmental issues that are going to come up. We'll bring you back in just a minute, but right now it's time to bring in someone to talk about the other side of the effects. Next up, Dr. Laura Tabikoff, a medical doctor specializing in physical medicine and rehabilitation. She's now also a faculty research instructor at the Icahn School of Medicine at Mount Sinai. First, Laura, welcome and congratulations on that recent appointment.
Thank you so much, Jimmy. Thanks for having me.
Our pleasure. You just heard Jenna talk about physical symptoms. Let's change our focus to some different types of symptoms, cognitive symptoms. What were those symptoms that were affecting these people typically reported?
Yeah, absolutely. So over half of the participants reported something called brain fog, which is somewhat of a new term used to describe things like difficulty concentrating, keeping up with conversation, and short-term memory loss and multitasking. So we also noted that 63% of participants also scored for at least mild cognitive impairment on a well-validated patient-reported outcome that we used called the NeuroQol cognitive function. And about 15% scored for severe impairment on that same scale, which is quite concerning. So to answer your question, main cognitive symptoms that we observed were brain fog, confusion, and memory loss.
Wow, 63%. I just want to bring that up again. 63% scoring for at least mild cognitive impairment on that validation tool. Wow. Let's talk about the study overall. What's novel about this compared to others that might have been similar to it?
Yeah, that's a good point. So a lot of studies over the past year reported the persistent symptoms after COVID-19 infection, and our findings are mostly in alignment with those reports. The novel thing here is that we quantified levels of disability associated with these symptoms, and we measured their impact in quality of life, function, and ability to participate in society in general.
All right, so let's talk about that in terms of participation. What are the impacts on people's lives? Let's talk about it really specifically because of the physical and cognitive symptoms combined.
For sure. So we noticed that these symptoms were impacting multiple aspects of people's lives. So it appeared to be impacting employment, first of all. So we noticed that levels of full-time employment reduced from 76 pre-COVID to 41% post-COVID. And the majority indicated that this was due to their illness, so not loss of employment due to the pandemic in general, which is important. Second of all, people reported limitation in performing usual activities, so including housework, study, family, and social activities, as well as tasks related to self-care. And finally, they reported performing physical activity less often after COVID, which is alarming given the well-known negative impacts of physical inactivity.
Wow.
So all of this really highlighted the need for skilled rehabilitation.
I'm just going to say that statistic again, 76% in terms of employment pre-COVID to 41% employment post-COVID related to the effects of post-COVID-19 syndrome. Wow. Laura, we'll bring you back in just a moment. Finally, on the broadcast today, our next guest is a physical therapist and the director of rehabilitation innovation at the Mount Sinai Health System, Dr. David Petrino. David, welcome.
Thanks, Jimmy. Good to be here.
Let's talk about the bigger picture here. How should the information that you learned here in this resource be used to potentially inform policy? Let's talk about that.
Yeah, I think it's a great point. This is a very important study from that perspective because it's one of the first studies out there to really dig in detail in a peer-reviewed journal to show exactly how long COVID sufferers are being severely affected in their ability to perform day-to-day tasks. And this is exactly the sort of evidence we need to bring to government officials. We need to bring to governing bodies and say, we need to start to build policy to protect these individuals, to make sure that they're counted, to understand that that their lives are being dramatically affected and that they need social support, medical support, and financial support to get them back to health.
That's a good look at policy of the big picture, what we should do that we've learned from this. But let's talk about next steps and looking towards the future. What could the next steps be for helping people living with long COVID?
Yeah, I think that this team that has been involved in this publication and many others surrounding long COVID are absolutely phenomenal, and I think that our last few publications have really done a good job of characterizing what long COVID looks like, how it feels, and how it's affecting individuals. What we need to do now is focus a lot of our research toward what is happening in the body physiologically that is causing these symptoms. Understanding the pathology behind long COVID is really the next step in starting to develop targeted and effective therapeutics for these individuals who are experiencing persistent and lasting disability and symptoms.
And just for the audience out there, we have put the link directly to this resource in the comment section below. You can find it published in the American Journal of Physical Medicine and Rehabilitation. The title, Post-acute COVID-19 Syndrome Negatively Impacts Physical Function and Cognitive Function and Health-Related Quality of Life, along with participation. David, thanks so much for your insight. Let's bring the rest of the team back on. This is an opportunity for some parting thoughts, or as we go forward. Let's go in the same order that we had you on. So Jamie, what would you want to leave with the audience as they hear your words today?
This is a multi-system disease, and I think it's very important for clinicians and researchers, to not just focus on the cardiovascular and pulmonary systems and cast a wide net on assessment.
Thanks so much. Jenna, what do you have for the audience as we wrap up?
Sure. So based on the findings of this study, where 86% of individuals reported exertion as being one of the key factors that exacerbated their symptoms, now more than ever is the time for rehabilitation and physical therapy in a skilled fashion and an educated way to provide care for patients. So definitely seeking rehab.
Yep. And targeted and skilled. I love those two words there together. Laura, what would you want to leave with the audience today?
Yeah, so I think a key message here is that people can have persistent symptoms and functional impairments even after having mild acute infection and never being hospitalized. So learning to identify this condition properly and referring to skilled rehabilitation professionals is absolutely crucial.
All right, thanks so much. David, we wrap it with you.
Yeah, I mean, I think that what the others have said is really amazing. And I'm just here to express a lot of deep gratitude for the individuals with long COVID who participated in this trial. Right now, people with long COVID are the experts on this condition. And it's their willingness to participate in this work, even when they're feeling extremely debilitated and unwell, that is moving the science forward. And we're seeing incredible work being completed by patient-led organizations as well. So just a lot of gratitude for the people who participated, as well as our amazing researchers who are not long COVID experts, because no one is. Taking the time to get this work out there so that we can help people with long COVID is very important to us.
I want to thank the team not on the screen that helped bring this resource to life as well. And again, we have the link directly to it in the comments below. Ladies and gents, thanks so much for the opportunity to share this information. Thank you so much.
Thanks, Jimmy.
Thank you, Jimmy.